let's talk about eclampsia and preeclampsia and how we might treat that in the pre-hospital setting. So for the sake of simplicity, eclampsia is just preeclampsia plus seizures. So preeclampsia is defined by proteinuria and hypertension either in pregnant women or postpartum women. So we add those two symptoms plus seizures, we have eclampsia. So how do we treat it? Well, unfortunately, the only true treatment is delivery of the child. But for preeclampsia, we can typically manage this many times before it advances to eclampsia with the proper prenatal treatment. And often you'll see in EMS and in the hospital that magnesium sulfate is given. So for us in EMS, you'll probably see a loading dose or a bolus initial dose of 4 to 6 grams, depending on your region and protocols. So what causes preeclampsia and eclampsia? Well, bummer, we're not really sure. But we do know that it is a disease of the placenta which causes placental vasoconstriction, but it also causes systemic vasoconstriction. And some of the organs that are hit hardest are the kidneys, the brain, and the lungs. So when we see kidney involvement, that's why we often see that proteinuria. So for the kidneys, they're extremely vascular. So when we see this systemic vasoconstriction, those kidneys are really hit hard. We also see issues with our brain. So let's talk about the brain. With global edema and hypertension, this is a recipe for disaster in the cranial vault. We see an increase in pressure, which can lead to seizures, and that's when we start seeing those eclamptic patients. But did you know that you can also have pulmonary edema? It's one of the more rare lethal side effects, but it's definitely something to look out for. So there you have it. Our initial dose is going to be 4 to 6 grams of mag, and that's typically what we see in EMS, followed up by continued therapy in the hospital. In a later video, we'll talk about how preeclampsia and eclampsia can affect the liver in HELLP syndrome, which is especially lethal. So remember, follow your local protocols, and we'll see you next time.